It's time for The Verdict. The Verdict is a lively discussion of current events and legal issues pertinent to Oklahomans. The Verdict is hosted by Kent Myers and Mick Cornett. The Verdict is sponsored in part by the Able Law Firm. It's time for The Verdict.
And welcome once again to The Verdict. I'm Mick Cornett, and I'm joined as always by one of Oklahoma's top legal experts, Kent Myers. Kent, what do we have today?
Well, today, Mick, we have the first of a two-part series on something that is really a terrible scourge in Oklahoma, methamphetamine. It's a problem that is alive and well, I'm sorry to say, in Oklahoma, and we're going to evaluate it in depth the next 2 weeks. Today we're going to be talking about what is methamphetamine, how is it created, how is it ingested, how addictive is it, and how does one get any treatment for it. Next week we're going to be talking about the problem in Oklahoma and Oklahoma County, what can be done insofar as adjustments to our penal system to make treatment of meth offenders more realistic in our tough budgetary times. But today we're going to be talking about methamphetamine, what it is and how dangerous is it, and I think we're going to find out it's very, very dangerous.
Well, let's get started. This morning, a frank discussion about methamphetamine and what it does to your body. It's next on The Verdict. And welcome back to The Verdict. Mick Cornett with Kent Myers, who's going to introduce our guests.
Very pleased today to have two guests that are very knowledgeable about the subject of methamphetamine. Across the table is a longtime friend, J.C. McNutt. J.C. is a licensed social worker, a therapist, a native Oklahoman, a graduate of Capitol Hill High School, received college degrees from Oklahoma City Community College, University of Central Oklahoma, or Central State then, and the University of Oklahoma. J.C. is a licensed and practicing drug and alcohol therapist and has been for 20 years or so, and sees methamphetamine problems almost daily. This is J.C.'s first visit to The Verdict. Thank you very much for joining us.
Thank you.
We're really glad to have you. Next to me is a return visitor to The Verdict, Dr.
Yes.
Marianne Bowman, a doctor, board certified in internal medicine. Been affiliated with Integris Hospital since 1991, and is featured often and almost daily on local television shows around our competitors, and we're very pleased she'll share her talents with us. And she's going to talk today a lot about the physiological effects of methamphetamine. Dr. Bowman, thanks for making a return visit to the
Glad to be here. I had fun the first time.
Well, we're sure glad to have you back.
Thank you.
And let's start right with you. Tell us, what is methamphetamine and what effect does it have on the body once it's been taken?
Methamphetamine is a psychostimulant. It is a stimulant to the brain, stimulant to the body, similar to cocaine, but with longer lasting effects than cocaine, and really affects the brain a little bit differently than cocaine. It speeds up your heart rate. It is speed. I mean, that's what we've known. Amphetamine, its precursor was amphetamine, and then methamphetamine was probably started in about the 1930s or so, and it was used in cold remedies. And actually Hitler used methamphetamine during World War II, and there's some thought that that his brittle character and all, that the war may have been very different if he wasn't high on speed during a lot of this time. So it speeds up your heart, it may raise your blood pressure, it gives an intense, pleasurable sensation to the brain because it affects the dopamine in the brain, and dopamine is one of the neurotransmitters, one of the brain transmitters that affects our pleasure. It's involved with our pleasure sensation, and that's why the very pleasurable effect that people get with methamphetamine.
Does it keep you going for a while?
keeps you awake, will keep you going. It's been used in the past, years ago, by athletes to keep them going. It's been used by people who had jobs that they needed to stay awake. But it was recognized around the 1980s as being dangerous.
Let me stay with you just for a minute on this subject. As a practicing physician, is there some medical equivalent of methamphetamine that is a prescribed drug that a doctor will occasionally prescribe for a patient?
We do use, in some circumstances, some of these medications in much lower dosages. It's used for narcolepsy. That's a condition where a person cannot stay awake. They'll be talking to you, then they're asleep, and then that is used to help with a stimulant there. A variation on this is used for attention deficit disorder. What is felt in children with attention deficit disorder is that they are not getting enough impulses in. They're not, there's a part of their brain that is not getting enough sensation in. So if you give them something that stimulates, then they get more sensation in and they relax, because otherwise they're constantly looking for where can I get input. So it is used in some cases also for attention deficit disorder. Lower dosages, narcolepsy is not very common, and it's not used regularly.
Well, JC, without giving us a specific recipe, how is meth created?
Well, there's some legal drugs that they can just go purchase at the store and then change their, by heating, cooking. We first ran into this with PCP. Remember PCP? They cooked it in their back porch. This seems to have some volatile things, and of course we don't want to talk about the prescription of how to do it. And I think, like I said, it's
Is it hard to do? Is it something, if you just wrote it down and that a person could do if they just followed these directions? Is it that easy?
If they're very diligent, obviously, very cautious of the danger. Of course, these are people who don't seem to care about danger. So I don't think it takes a brilliant person and talks about a lot. It started probably in college, some college.
Well, it seems to me that makes it unique, because for all I know, you can't make your own heroin. Or without going into a tremendous amount of trouble and planning, could you grow your own marijuana? I mean, it seems to me that from that standpoint, that methamphetamine is something that a person could logically, conceptually pull off by themselves if they chose to.
Oh, yes, much more available. Again, doesn't take a wizard or a rocket scientist to do it.
Are the ingredients very expensive?
No.
The precursor is ephedrine, and ephedrine is not that available. It used to be very available, and you use pseudoephedrine now, which is in all kinds of cold remedies. And then you have to use acid, hydrochloric acid, battery acids are used. That's what makes it so dangerous, using some of the things that you have to put together to cook it, to change the relatively inert ephedrine or pseudoephedrine into something that is a methamphetamine.
Well, JC, we obviously know the problems for the user, but what about associated problems with other members of the household or small children that might be in a household where meth is being cooked? What are some associated problems like that?
Unfortunately, it appears to be kind of our new cottage industry, and the whole family seems to be involved. I noticed in the paper the other day, a young man showed up with burns that were obviously from something like this, at least. And in the last line of the deal, his wife and child got away from the fire. So it's being cooked in homes many times by women, which are cooks.
What about residue that might be on the carpet?
Yes.
Is that frequent?
Yes, oh my. And the smell in the past has been, they claim...
And all of that's dangerous to the others.
Oh, yes, yes.
And not only that, but they throw all the chemicals down regular drains, so this is an environmental hazard as well with the disposal of it. And there have been cases of lead poisoning because the meth is sometimes transported in lead-type containers. And so just like leaded paint, if you get into it, if you're using the methamphetamine from these leaded containers, you can have high levels of lead.
And you can only imagine the financial costs associated with all these social costs as well.
Right.
Let us get us to a break. We're visiting with J.C. McNutt and Dr. Marianne Bowman. You're watching The Verdict. Very nice. Mick Cornett, Kent Myers, and our special guest back on The Verdict. This week's guests are Dr. Marianne Bowman and J.C. McNutt. We're taking a somewhat scientific approach in discussing the dangers of methamphetamine. Kent, what's next?
Well, J.C., I know that nicotine is typically ingested by smoking a cigarette. Alcohol is typically ingested by drinking it. What are the ways methamphetamine can be ingested into the human body?
Well, both those ways. You can take it by mouth. Some people snort it up their nose. It can be smoked, and then certainly can be injected. And it's apparently water soluble, so they can put it in a needle and put it in their arm.
Is there a predominant way, or do you see in your practice, do you see all kinds of ways?
I asked, and a guy yesterday said he snorted it, but most that really have a problem with it are smoking it with a special pipe, and they mentioned the kind of pipe, and a special kind of meth that seems to be more effective when you smoke it. And of course, when you expose a huge area like big as a football field to your lungs, which that is, big slam in there.
Well, Dr. Bowman, I don't know exactly how you measure addictiveness, but is methamphetamine one of the more addictive drugs, and how do you measure those types of things?
Methamphetamine is very, very highly addictive. Part of it is because it affects our pleasure center, and because you become tolerant to it within a couple of minutes, especially if you're smoking it or if you're injecting it, you want more and more and more. So one of the things that you have with the definition of addictiveness is that you develop tolerance and you need more and more and more, and you increase your amounts, and that's what happens. The other thing with addictiveness is that you have a craving when it goes away, and this is the real key, and this is why this is such a terrible problem. Not only for all of the acute things, the acute deaths, the dangers of explosions, but also people have a very hard time getting off of this drug because it affects the brain permanently in terms of your pleasure centers, so you're looking for that all the time, and sometimes you can't get the pleasant sensations again, and it's very difficult to stay away, and the cravings last for a long period of time. You also have psychosis afterwards. People get flashbacks. This looks very much like schizophrenia with hallucinations. In fact, they have used some drugs that are used for schizophrenics, some of the antipsychotic medications, to try to treat these people. It's a bad problem.
J.C., you're a licensed therapist. You see these people, if not daily, maybe weekly or monthly. What are the current treatment methods available to try to help a meth addict that really wants help?
Key word, really wants help to stop doing it, needing cognitive restructuring, what you're telling yourself. Of course, the ones who can get into the AA type things, the 12-step programs, where they've got some support. There are some Cocaine Anonymous, and I suspect there will be Anonymous, maybe, for people using meth Anonymous. But it is the one, as far as I'm concerned, about the only way out.
Dr. Bowman, if you had a patient come to you that wanted off, what would your advice be?
Well, I would definitely get them into a program. I don't think this is something that you can kind of decide I'm going to do on my own. I think they need to get into a program, a behavioral type of a program. We might sometimes need to use antidepressants on these patients because depression is an issue. I would have them, if they were having the psychotic types of considerations with hallucinations, they'd need to see a psychiatrist. I definitely agree with 12-step programs, but because this affects the chemistry of the brain so permanently, I think we don't yet have the best treatments for them, but I would get them into a treatment program, and I would tell them this is going to be tough, and this is going to be tough for a long time.
J.C., on that treatment, let me talk about a couple of more things. With the alcoholic, there may be a need to hospitalize and dry them out for a period of time before treatment can even start. Or a 12-step program or similar treatment can even start. Is there that kind of a problem with a meth addict as well?
Well, it's more severe than that. In fact, they probably need to go to the crisis center if they don't have access to, a regular psychiatric hospital where they've got insurance and so forth. Most don't. If you have the people who are having the psychotic, they must get to someplace to get some medicine. So it starts maybe there. There is also the referral center, which is a 7-day program. I haven't talked to Eddie McElroy yet, but I suspect they may be working their way into it. Ben Brown assured me yesterday that they're working as fast as they can work to get our state up to snuff and down at Griffith
That's Senator
Memorial.
Brown you're talking about.
Ex-Senator Brown, yes.
Ex-Senator Brown.
Well, in your opinion, are we doing enough?
Well,
Are we addressing the problem adequately in Oklahoma?
you know, that's so subjective. I think so. I think right now we have found out this is really a problem, and I think they didn't pay attention to it like they have. It has their attention now. Funds. How do you get the funds? And so we're splitting up the mental health money. Now this is getting over into dual diagnosis almost. I think some of the mental money will be helpful here where it isn't with alcoholism maybe.
The other thing is that there is not as much of a physiological withdrawal as you get with alcohol.
What do you
where
mean by that?
Someone has actual physical symptoms, blood pressure problems, tremors. There's a physical craving for the drug. This drug doesn't have as much of that. It has more of the psychological craving for it, and that's very tough to break.
Let me ask you both a question. You expect a certain success or failure rate in treatment of alcoholism or perhaps heroin addiction and all. What about meth? Is there a pretty high success rate or a pretty high failure rate?
Well, I wouldn't put it success and failure. We're learning. We're learning, we're learning, we're learning.
Or recidivism then, falling back into it?
It's dire as we speak, I think, with enough people. Things like this, getting people informed, finding out there are people that know about it. But as far as success and failure, I'd have difficulty putting it in those terms right now.
Dr. Bowman, do you have any ideas that haven't already been stated on the show? What do you think, you know, if you don't have an answer, what are some solutions that you'd like to see us pursue?
I think the education aspect, kids are using this. 4.4% of high school kids in 1996 had tried meth, and this was up from 1990 of 2.7%. That's a big jump. So I think kids don't necessarily think it's not as bad as other things, and it's cheaper to get. I think the education aspect has to happen. I think ephedrine is one of the things that is used for the initial reagent that you need. Ephedrine causes other problems. There have been deaths in people taking it. It's in weight loss medications that are over the counter. It's in energy boosters. I think ephedrine, the FDA's put out a warning on it. I think it needs to be taken off the market. Sudafed, however, pseudoephedrine, we do use. Sudafed, your cold remedies, I don't think that's going to go away. I think monitoring who's buying large quantities of this and where it's happening is probably a good idea as well.
I want to thank you both for coming on The Verdict. I think we all have learned a lot.
My pleasure.
Thank
you.
We're going to wrap it up there. Dr. Bowman, Mr. McNutt, we'll be back with a few final thoughts after this. You're watching The Verdict with Mick Cornett and Kent Myers. We are back to wrap up another edition of The Verdict. A fascinating show. I know I learned a lot.
I learned an awful lot, and of course when you have good guests like J.C. McNutt and Dr. Marianne Bowman, you're bound to learn a lot. They're very knowledgeable, know exactly what they're talking about, have been dealing with it for years, and know the seriousness of the problem. What a horrible problem this is. It's a drug that is very cheap to get, very easy to ingest, and brings about just absolutely disastrous results. It is a problem of overwhelming proportions in Oklahoma, and on our next show next week we'll have District Attorney Wes Lane and State Representative John Nance talking about the scope of the problem in Oklahoma. And I think we're going to find that along with other things we apparently have a bigger problem than many states, and we'll try to explore some of the reasons for that. But we're in the middle of a meth explosion, pardon the no pun intended, explosion of use, explosion of bad things happening to families, to little children that aren't taking it but are exposed to it. And quite frankly, our state is just going to have to get a handle on what we can do about it and do a better job of dealing with it.
And we'll learn more next week. Thanks again to our guests, Dr. Marianne Bowman and J.C. McNutt. Be sure and visit our website, theverdict.tv. For Kent Myers, I'm Mick Cornett, and we'll see you next time on The Verdict. Well, thanks for sticking around.
Thank you all.
The Verdict is sponsored in
JC,
part
appreciate it.
by the Able Law Firm.